we are now moving on to the question and answer session. So if you do have any questions written on papers, please raise your hands and one of the volunteers will come around and grab the piece of paper off you. If you need a piece of paper, raise your hand and they will bring them to you. So I will start off with a couple questions about you. My first question, where did you study or learn about pediatric physiotherapy and why did you choose this field?
Always it's my aim to come into a medical field. So I was short of marks. I didn't get MBBS, Master of Bachelor in Medicine, so I got into physiotherapy. At that time I don't know anything about physiotherapy, but after coming into it, I never regret that I cannot become a surgeon. Okay? So I'm really having a very good time, and every day I sleep. I have a very peaceful sleep and I have full job satisfaction. Full of job satisfaction.
Perfect. My next question, how are children identified and referred to you?
We get clients, patients from neurologists. They identify. Sometimes we get individuals coming directly to the physiotherapists. They have those who know what is physiotherapy before. So we have direct patients as well as referrals from pediatricians, neurologists and physiatrists.
Okay. Now, how do you deal with the misdiagnosis? For example, parents perhaps self-diagnosis and they feel very, very strongly that their child.
It's a very good question because of internet, people come to their own decision and sometimes they self-treat or they go to a different doctor. So always we assess, we have our own assessment forms to be filled by the parents or by the child or the person itself, and then we give referral services if needed.
Okay.
Yeah.
Now, do you work with the children through to adulthood and thereafter? For example, do you work from them from an age of 4 until 30, 40 years old?
As I said earlier, pediatric physiotherapy would be like lifetime.
Oh, okay.
Yes.
Okay, perfect.
Intervention is needed in every part of their life, every aspect of their life. It starts, pediatric physiotherapy starts from birth.
Okay.
Yes.
Now, how do you educate prenatal parents? So,
Prenatal parents?
well, sorry, prenatal mothers.
Mothers, okay.
How do you work on educating them from the hospital level? Do you advertise and say you should get a scan, or how does that work?
Yes. It's kind of, we give counseling services. We do give counseling services. We have some things to, like, prior to their delivery or thing, we give them counseling.
Okay.
Yeah, it's kind of counseling, and we give some presentations to them, to the expected mothers, like that.
Perfect.
Yeah.
And my last question, how has media helped to educate the mass public? Do you find that there is now more education, more knowledge about it, or do you find that it hasn't done much? So
I wouldn't say that it hasn't done much, because these days people are very much aware because of the development of technology and internet and everything. People are much aware of that, but still, when we go into the rural, urban is fine, but rural, it is unnoticed. Many of the children's problems are unnoticed. And the one more thing is, everything we put under one umbrella, right? If a child is not good at studies, we put them in mental retardations, like that.
Yeah.
So in that aspect, I think people should know more about these. They should learn more about this and get with other people, professionals.
Perfect.
Yes.
Thank you very much for that enlightening question and answer session. I'll pass it on to you. Thank you for